here's what some of the points that we think the legislation is going to accomplish. First, we think it's going to rein in insurance premium rates, and I'll get into some details later about how we think we're going to accomplish that. Second, and I think probably everybody in this room can appreciate this one, from now on, you will no longer be denied coverage because you have a pre-existing condition. And I'm virtually positive either everybody in this room has a pre-existing condition, knows somebody has a pre-existing condition, has a family member with a pre-existing condition. So that I actually think this is one of the most important components. In fact, United Healthcare, for example, has 425 conditions that they list for why they can deny you health care. You know, so this is not just one or two diseases or conditions you might have. There's a lot of conditions why insurance companies now feel they can deny you coverage. And in fact, just last year, 615,000 Americans were denied health insurance because of a pre-existing condition. We're going to eliminate that. Already, September 23rd, 2010, which took effect, any child up to the age of 19 already can't be denied insurance because of a pre-existing condition. As of 2014, that will be true for all Americans. And again, I think that's a really important part of this legislation. We also think we're going to make health care more affordable for middle-class families, and we think that will be happening in two ways. First, we're doing something called exchanges. We're creating exchanges, and what exchanges are competitive marketplaces for insurance providers. So, for example, I live in Philadelphia. I can only get my insurance from Independence Blue Cross or Cigna or Aetna. Very small group of insurance providers I can get my insurance from. I can't get it, for example, from Highmark in Western Pennsylvania or Blue Cross in Northeast Pennsylvania. But come 2014, when we create these exchanges, I get now to shop for my insurance from all the providers in Pennsylvania, and they are now all competing for my business. So again, we feel like this competitive marketplace now will make it more affordable because it's going to bring down some of the costs. The second way is that we're going to subsidize premiums for middle-class families. So any family making up to 400% of the federal poverty level, that's about $88,000 a year for a family of four. The government will subsidize your health insurance. So again, we think that's the two ways that we're going to make insurance more affordable for middle-class families. We also think it's going to be more affordable for small businesses by some tax credits which took effect in 2010. I'll get into the details of that in a few minutes.